It's everywhere, right? From celebrity social media feeds to news headlines about billion-dollar shortages, Ozempic has just completely exploded into our lives. People are calling it a miracle drug, a total game changer, but what is it really, and who should actually be using it?
So in this explainer, we're going to put right through all that noise, all the hype, and get to the pure science. We're going to break down exactly how these drugs work, their incredible benefits, and the very real downsides that people just don't talk about enough. By the end of this, you are going to have a much clearer picture of the real story behind Ozempic and whether it could even be a fit for you. Okay, let's get into it.
All right, first up, hype, meet hormone. See, to really understand the drug, we first have to understand our own bodies. Because the secret behind this whole class of medications, it's not some crazy new invention. It's basically a superpowered version of a hormone you already have inside you right now.
Okay, so here's the core idea. Every time you eat, your gut releases a hormone called GLP-1. It's just a natural signal in your body's communication system. What drugs like Ozempic do is they mimic this hormone, but they do it in a way that's much, much stronger and lasts way longer. So they're not really introducing something totally foreign. They're just turning up the volume on a signal your body already knows how to use.
And this simple process has a powerful three-pronged effect that makes these drugs so effective. First, it sends a signal to your brain's appetite center, which dials down your hunger. This is what people are talking about when they say it quiets the food noise. Second, it slows down how fast your stomach empties, so you physically feel fuller, for longer, on less food. And third, and this is the really smart part for diabetes, it tells your pancreas to release insulin, but only when your blood sugar is actually high. It's that combo that drives all the results we're seeing.
So while Ozempic is the name everyone's heard, it's really just one brand name. The actual drug, the active ingredient, is called semaglutide. And that exact same ingredient is also sold under the name Wegovy, which is the one specifically approved for weight loss. And there's a whole family of these drugs. Tirzepatide, which you might know as Mounjaro or Zepbound, is even more powerful because it mimics two different gut hormones, not just one. Okay, so what does all this science actually do? Well, it leads to two massive headline-grabbing benefits that are driving this crazy demand: truly significant weight loss and game-changing diabetes control. Just look at this number. It is absolutely staggering. In a major clinical trial, people taking the highest dose of tirzepatide, that's the dual-action one, lost an average of 22.5% of their body weight. I mean, think about that. For someone who weighs 200 pounds, that's a 45-pound loss. The results for semaglutide, or Ozempic, are also incredible, sitting around 15%. This is a level of effectiveness that, until now, we've really only seen with bariatric surgery. But you know, the number doesn't even tell the whole story. The really profound part is how it works. On the left, you see the clinical term central appetite regulation. But on the right is what people who take it actually say, and it's life-changing for them. They talk about food noise, that constant nagging chatter in your brain about food, about cravings, about your next meal. And they say it just goes quiet. It's not about having more willpower, it's a fundamental biological shift.
And we can't forget, these drugs were invented to treat type 2 diabetes. And for that, they are a phenomenal tool. This chart basically shows a typical drop in what's called HbA1c, which is a measure of your average blood sugar over a few months. These drugs can lower that number by 1 to 2.4 percentage points. That is a massive, massive improvement. It's enough to take someone from being poorly controlled to being really well managed.
And the benefits keep going. They go way beyond just blood sugar. A huge study called the SELECT trial showed that for patients at high risk, semaglutide reduced the risk of major cardiovascular events, we're talking heart attacks and strokes, by a whopping 20%. So this isn't just about managing a number on a chart. It's about preventing life-threatening events and even helping to protect the kidneys over time. Okay, the benefits are clear and they are powerful, no doubt about it. But that is only half the story. Now we have to talk about the part that gets lost in all the hype: the side effects, the incredible cost, and the level of commitment that you absolutely have to understand before even thinking about these medications. The most common side effects are all related to your digestive system. And listen, they are not trivial. As you can see, nausea is a big one, affecting up to 44% of people, especially when you first start or when your dose goes up. Now, for most people, these symptoms do get better over a few weeks, but for some, they're just so bad that they have to stop taking the medication entirely. And this is critically important. These drugs are not for everybody. There are what we call absolute contraindications. If you have a personal or family history of very specific types of thyroid cancer, or if you've ever had pancreatitis, these medications are simply not an option. This is exactly why you have to be under a doctor's care. This is not something you just go buy from some sketchy source online. This right here, this gets to the heart of the commitment. This is not a quick fix. It's not a 30-day diet. The biological effects, the quiet appetite, the slow stomach, they only work as long as the drug is in your system. The moment you stop, your body's old signals come roaring back, and the studies are clear. Most people regain the weight. You have to think of this as a long-term, maybe even lifelong therapy for a chronic condition.
And that long-term commitment? Well, it comes with a jaw-dropping price tag. In the US, if you don't have good insurance, you're looking at over $1,000 a month, sometimes up to $1,500. And getting insurance to cover it is a huge battle. They'll often cover it for diabetes, but fight you on covering it for weight loss, even though that's now recognized as a chronic disease too. This financial reality just puts it completely out of reach for millions. Beyond the common GI stuff, there are other serious, though much rarer, risks to know about, like pancreatitis and gallbladder issues. And here's a crucial one to watch: muscle loss. When you lose weight this fast, you don't just lose fat, you can lose a ton of precious muscle mass too, unless you are very intentional about fighting it. And that means you have to do two key things: focus on consistent strength training and make sure you're eating enough protein. So where does all this leave us? Well, when you put it all together, the stunning benefits and the very serious realities, the right way to think about this comes into focus. This isn't some magic cure-all. It's an incredibly powerful medical tool. And just like any tool, how well it works depends entirely on how you use it. So, how do you unlock that full benefit? First, you have to pair it with lifestyle changes. The drug makes eating healthier easier, but it doesn't do the work for you. Second, like we just said, prioritizing protein and strength training is non-negotiable if you want to protect your muscle and your metabolism. And third, you have to track your body's response. You need to understand how your blood sugar is changing, how different meals are affecting you, and how your side effects are evolving. That data is what helps you and your doctor see if the medication is actually working the best it can for your specific body. And of course, we have to state this very clearly. This explainer is for educational purposes only. It is not in any way a substitute for professional medical advice. Any decision about medication has to be made in a conversation with your own healthcare provider who knows your full medical history. So we come all the way back to that central question. This is a powerful tool. It has transformative potential, but it comes with significant trade-offs. The goal here was to make sure that now you understand the science, you understand the promises, and you understand the realities, so you're equipped to have a truly informed conversation with your doctor to decide, is this powerful tool right for you?